Malaysia is stepping up diagnostic testing to identify and isolate COVID-19 hotspots. The move is designed to flatten the curve of infections. The number of new cases is expected to continue to increase because more cases are being detected. 217 new infections and 3 deaths have been reported today. More hospital beds are being added to the health system in anticipation of a surge. And this includes converting some training institutes and convention centres into temporary hospitals. Melissa Goh has visited one of the new facilities.
Now, so far, Malaysia has been seeing an increase of between 100 and 200 new cases a day. There hasn't been an exponential surge, despite predictions by some research houses that cases will peak middle of April with more than 6,000. Now, the Health Ministry officials said that although there are initial signs that the curve is flattening following the imposition of the strict movement control order more than 2 weeks ago, the war is not won yet. The cases are going to go up further as Malaysia steps up testing. Now, it's better to be over-prepared than caught unprepared. Now, face it, Malaysia can't build hospitals like China within days, but what authorities here have done and will continue to do is to convert training institutes and exhibition centres like this one here that belongs to the Agricultural Ministry into temporary hospitals. Now, this facility here, with some 600 beds, is put together in just 3 days. It's now ready to treat and care for COVID-19 patients who have mild symptoms or no symptoms at all.
This is the first time we are building this. So this is history for Malaysia. I hope we don't need to use it, but if we need to use it, we are ready.
Now, to embrace the unprecedented challenge, the authorities are also increasing its diagnostic testing capacity. But there's still a backlog at the moment with more than 7,000 tests pending. Now, Malaysia aims to ramp up its capacity to handle more than 15,000 tests a day. Right now, the health authorities are still trying to identify the best test kits to do so. Now, mass testing is necessary, health experts say, in order to control clusters before they flare up in the community. Now, several villages, including a high-rise building in Kuala Lumpur, now under complete lockdown after scores of new cases were reported this week. Now, while it's a race against time for authorities to get their hands on enough ventilators for the ICUs, the public hospitals, the ministry said, are in need for another 500 when cases peak.
Untuk critical care, iaitu ICU, 410 bed. Dan ventilator kita mempunyai 634 ventilator.
Now, meanwhile, protective gowns, gloves, masks and face shields have now been replenished, although there were reports of shortages earlier. Now, it's now a logistical challenge to get them to the frontliners working in rural areas as quickly as possible. Melissa Goh, CNA, Kuala Lumpur.